He was a brutal pimp. He said to her and to all his victims, I am your celestial overlord and sayer, and I own you body, mind, and soul. And that's not the kind of language you get from your garden variety high school dropout pimp. But he was just as brutal as them and would threaten his victims the way other pimps do and say, you know, you kill them, torture them, mutilate them, and even hurt their families if they dare to leave him.
Of the many thousands of cases this longtime Toronto Sun court reporter has covered, he remembers this one well. It was 1999. This man, Gary Wayne Gabriel Patterson, was awaiting trial on 10 pimping-related charges.
He became on my radar, because it's unusual for a lawyer to be charged with pimping. He was a lawyer, but he wasn't the kind of lawyer that I would come across. He doesn't go to criminal trials, wasn't a big civil litigator. It was unusual that he was a lawyer and that he was charged with these pimping offenses and that they were in 2 different jurisdictions. You got Las Vegas and Toronto.
Patterson managed to find time for other business interests too, including a pharmaceutical business called Grand Medicine, a business that in 1999 vied for a lucrative government contract to provide mail-in prescriptions to people living on 20 First Nations in Northern Manitoba. His business won the contract while Patterson was awaiting trial in Toronto and was wanted on similar pimping-related charges in Nevada.
That doesn't surprise me at all. He seems to be a pretty slick operator. He seems to be the sort of person that can charm people. He can portray the role he needs to portray to get the job done. He is very persuasive. He was charming and manipulative. That doesn't surprise me whatsoever.
American authorities never did seek extradition to pursue that matter. How could a business owner facing such serious charges make it through the vetting process to get a contract to provide medications to an Indigenous population in Northern Manitoba? Turns out nobody in government, even then or now, knew about his criminal history. But we should keep in mind what else was going on in Manitoba in 1999 when he won the contract. Health Canada's top bureaucrat in that province was Paul Cochrane, an assistant deputy minister in charge of a $1 billion budget. An RCMP investigation found Cochrane was funneling money into the Virginia Fontaine Treatment Center on the Saugeen First Nation. In exchange for $70 million in federal contracts to that addictions facility, Cochrane admitted in court that he and his family received $200,000 in cash and gifts, including trips and vehicles. Cochrane was ultimately sentenced to 12 months in jail after pleading guilty to fraud and breach of trust charges. And it was this man who was in charge when Grand Medicine got the Northern Pharmaceutical contract.
In the late 90s, he was the federal deputy health minister. He was signing off on other healthcare projects on reserve during that time period in Manitoba.
Darren Jorgensen was a mail-order pharmacy pioneer back then, based in Winnipeg. He recalls being surprised that another Winnipeg pharmacy who had been doing the Northern prescriptions for years suddenly got the boot and this new company was in.
The ownership structure of Grand Medicine didn't involve a pharmacist, which should draw some suspicion. It's my opinion that Paul Cochrane played an integral role in the development in the late 90s leading up to this contract.
We called the former top health bureaucrat to find out at the very least why he signed off on it.
Hi, Mr. Cochrane. It's Melissa Ridgen calling. I'm a reporter with APTN Investigates. I'm calling again, trying to catch up with you to ask a few questions about a contract that was given out through Health Canada in the late 90s when you were Assistant Deputy Minister here in Manitoba. It involves a company by the name of Grand Medicine got the contract, and the owner at the time happened to be up on some serious charges, including pimping and uttering threats and kidnapping when he got this government contract. If you can give me a shout back, I'd like to pick your brain about how that happened.
He didn't return our calls. Meanwhile, just 4 months after getting the contract, Patterson's founding partner, Gail Halko, bailed from the business. She was the sole principal of a corporation that was a founding partner of Grand Medicine with Patterson. She vanished from the corporate paper trail as Patterson awaited his trial. In 2000, Patterson, now the sole owner of Grand Medicine and holder of the First Nations pharmacy contract, was convicted on a handful of pimping-related charges and sentenced to 7 years in prison.
It struck me that he was a chameleon sort of guy. When you looked at him in court, he's dressed in a suit, he looks all benign, and he's got that classic chameleon about him, that he can blend in whatever atmosphere, whatever environment he's in. When I interviewed people that he'd gone to law school with, they said that he was nice but kind of kept to himself, but he was very street savvy. He oozed a sort of street savviness that regular law students didn't have. It was as if he was bridging two different worlds.
He ultimately lost his license to practice law. But what about his pharmacy business? How could he run it from a prison cell?
I think he was trying to keep that on the down low, because you don't want to draw attention to it. If you raise that in a public courtroom, even for your sentencing, and say, well, this is a mitigating factor, I have this other venture going, the federal government will be alerted to it.
Instead of risking losing it, Patterson signed the company over to his mother. Court had heard testimony from Patterson's victims that his mother was herself a former prostitute turned school teacher. When she took over ownership of Grand Medicine, corporate documents said that she lived here and here. Modest digs, considering Grand Medicine was making good money from the government contract, plus dispensing fees and profits from the drugs themselves.
He and his mother they have two names, they use different names all the time. And I think they do that so they can't be tracked.
While the government had no clue who was behind Grand Medicine, their own records show that they paid the company between $52,000 and $300,000 a year. Then in 2003, with Patterson still in jail, his mother sells the company to a newly formed company called Northwest Healthcare. Here's where it gets interesting again. Gail Halko was hired as Grand Medicine's chief operating officer and given some shares. In 2005, though, two other names pop up as having shares in the company too. Patterson's twin daughters. They would have been 8 years old at the time. Soon after, Northwest Healthcare becomes the majority shareholder of Grand Medicine, and a free man after serving 4 of his 7-year sentence, Gabriel Patterson's name pops back up on the paper trail in 2008. Listed as president of Northwest Healthcare, which owned 51% of Grand Medicine at that time. Halko has the other 49%. Halko claims that the contracts were not continuous, despite the fact that government told us that they were renewed every year. She said there was a break in the early 2000s. We made a number of inquiries, but she declined to comment for this story until Wednesday, when she had issues with what APTN Investigates had broadcast leading up to tonight's program. She insists Patterson has not been an owner, partner, or shareholder in our company since 1999. He has in no way been involved in the operation or the governance of Grand Medicine since that time. That despite the documents we've shown you that confirm he is the president of Northwest Healthcare, which has majority shares in Grand Medicine. His daughters remain to this day shareholders in Northwest Healthcare. Going back a bit to 2011, the federal government expanded the company's contract. It provides prescriptions for now 22 remote First Nations and became a service provider for other non-insured health benefits. The government told APTN Investigates these services had a value of $9 to $10 million a year. Aaron Weir is the NDP's procurement critic and serves on the federal government's operations committee.
Well, it's just very surprising and very strange that the government continued to expand the contract. You maybe couldn't necessarily take the contract away from the mother because the son was in prison, but you have to hope that federal officials would do some due diligence before awarding or enlarging these types of agreements.
That doesn't surprise me either, that the government wouldn't do background checks on people. Although, before he was convicted, and when he may have put the application through, he's a lawyer in Toronto, passed Osgoode Hall, a prestigious law school, one of the most prestigious law schools in Canada. So he would have the bona fides.
If they checked out his credentials, wouldn't they have stumbled upon the fact he was a pimp?
Well, it's unclear, and I think that's why we need answers. That's why the federal government needs to look into this and get to the bottom of it, because on the face of it, it's very concerning, and we as citizens and taxpayers need to know why and how those decisions were made.
And there's even more. The contract was awarded year after year under the Aboriginal Set-Aside Program, which aims to give Indigenous-owned businesses a leg up on getting government contracts. Patterson says he's part African-Canadian, part Mohawk. While he did attend the Native Law Centre at the University of Saskatchewan, parole board documents questioned his heritage. In denying him day parole in 2002, the board noted that Patterson had no Indigenous support workers attend the hearing on his behalf. When questioned about this, you stated that you did not want to be part of the negative subculture associated with the Native Brotherhood at the institution. It is noted that you have served as chairman of the Black Inmates and Friends chapter. We requested an interview with Mr. Patterson through his lawyer. We laid out all the questions we had about his involvement with Grand Medicine, Northwest Healthcare, and we wanted to know what Mohawk community he's from. He declined the interview, but his lawyer insists, like Halco, that Patterson has no involvement with Grand Medicine, nor has he had since 1999. The lawyer's letter received yesterday states, Mr. Patterson is Afro-Métis, of Mi'kmaq and Mohawk heritage. He completed his correctional programming, served his time, and was an active member in the rehabilitative and healing programs that have aided him in being a law-abiding citizen. Grand Medicine lost the pharmacy contract in 2015. And when we come back, we explore a whole new set of problems for pharmacy patients in Northern Manitoba.
They have documented over 24 deaths as a result of people not being able to get their medication, and that's deaths.
APTN Investigates looks into whether there is any truth to that after the break. For almost 2 decades, Grand Medicine provided pharmaceutical and other health services to Northern Manitoba First Nations.
I've always wondered over the years how did they keep the contract, and they do provide good service, but you know, the bands have wanted to get involved in ownership of pharmacy services, and it seemed that Grand Medicine always had, you know, free will to continue on with the contract no matter what. That's my impression.
And were the services good for?
The services were very good.
The company was well paid for its services for many years, $10 million alone one year, according to government records. But the contract was initially awarded when the business's owner was up on pimping-related charges, crimes he was convicted of and served 4 years in prison for, unbeknownst to the feds who kept renewing Grand Medicine's contract. While behind bars, his mum took over the company. Then another company, Northwest Healthcare, bought Grand Medicine, a company that listed his 8-year-old daughters as shareholders. And free from jail, Gabriel Patterson became president of Northwest Healthcare, president of the company that owns 51% of Grand Medicine. Then there's the matter of the contract awarded under the Aboriginal Set-Aside program, based in part on him claiming to be part Mohawk. And that's just the beginning. In 2015, Grand Medicine lost the contract to Muskegee Pharmacy, and in the transition, some believe, may have resulted in patient deaths.
You take over a contract for 20-some remote communities on a distance-based model, 30-some thousand, 40,000 people, and everything turns a switch one night at midnight. Instead of a step process where 2 communities are switched, and then 2 weeks later 2 more, and then 2 more, it's an all or nothing switch. And I think that was part of the problem. I've been told by many people that during the transition time for the first 9 months, they would often have to wait 2-3 months for medicine.
Jorgensen says he brought it up with a senior Northern health official.
And I was with a prominent chief, and that we began discussing a number of things, and one of the topics that came up was the level of pharmacy services. This high-level bureaucrat told me and the chief that they have documented over 24 deaths as a result of people not being able to get their medication. And that's deaths. That's not like, so if there's 24 or more that are documented that died, how many were there that suffered other negative health outcomes? I kind of thought about it for 2 weeks, and then I looked up the populations of those communities, and I said that's about the population of Transcona in Winnipeg. And if 24 people died because of pharmacists playing games, trying to keep business, trying to get business, and 24 people documented died as a result of not getting their medication, if that was in a white community like Transcona, what kind of uproar would there be? And I couldn't stomach it anymore. I just made the complaint.
That complaint was to the College of Pharmacists of Manitoba. In it, he suggests the 2 pharmacies breached ethics codes by not cooperating with one another to ensure that drug customers didn't suffer in the changeover. It's been a year since he filed the complaint. Nothing's happened. The college wouldn't be interviewed for this story, but in an email said that they investigated Jorgensen's complaint, and at this stage, findings remain private as a decision has not yet been made as to whether there's grounds for discipline or whether their allegations are unfounded. Grand Medicine's Gail Halko questions Jorgensen's motivations, and he admits he may want to submit a bid for the Northern Pharmacy contract when it comes up for renewal.
No, we never bid because we pretty well knew we weren't getting it.
Did you bid in the last one when the new...
No, I never even bid.
Are you going to bid this time?
We're thinking of it.
As for the alleged deaths, APTN Investigates went looking ourselves. We asked for the critical incident reports from these 22 northern communities in the time frame that Jorgensen suggests they occurred. Because of patient confidentiality, what we received was heavily redacted. 54 pages of incidents. So blacked out it's impossible to know if anyone died or even if the incidents were related to medications. We went to the chief medical examiner of Manitoba to see if any of these deaths had made it onto their radar. None had. We went to the head of Northern Medical Services, which works on the front line of these 22 communities. Our requests for information or comment went ignored. So we reached out on social media looking for anybody who had any idea about people dying as a result of not being able to get their medications. We got nothing. Northern Chiefs Organization, no comment. Only people that would weigh in was the Assembly of Manitoba Chiefs Patient Advocacy Unit.
Our office never received any issues, calls, or anything of that nature. For the 2015-2016 years, no one's come to our office for that reason.
In fact, he believes pharmaceutical customers are generally satisfied with the service they got from Grand Medicine when they had the contract, and Muskegee, who has it now.
There's nothing perfect, so there's people that have issues with every pharmacy that goes up into First Nations.
What have you heard, just anecdotally through your job, about the services that these pharmacies provide to northern patients?
Well, the issues that arise from the two different pharmacies are not really, I guess, major in terms of people having major issues in accessing certain medications.
As for people not getting medications, Fontaine blames Ottawa.
We had a lot of cases in the past where we had to fight for certain medications to be covered, life-saving medications. First Nations Inuit Health Branch is cutting vital medications from, I guess, the medicine chest. Mm-hmm. Yeah, so they keep cutting. Every year they cut certain medications. So we always have to fight for our benefits. This takes weeks to actually finalize and to negotiate with First Nations Inuit Health Branch headquarters in Ottawa. So it takes some time, but during that time period, we always ensure that pharmacies provide patients with enough medication and forever all along the appeal process is finalized.
So I guess your argument would be, if it's prescribed, cover it.
Basically, exactly.
Yeah.
There shouldn't be a limit on what kind of meds we're entitled to.
In the meantime, the contract is up for renewal. The deadline for tenders was June 2nd. Jorgensen did not put in a bid. Neither Grand Medicine nor Muskegee would comment on the College of Pharmacists of Manitoba investigation or the allegation in Jorgensen's complaint. As for security and background checks for those who bid on government contracts, the government told us in a statement that there are more checks and balances now than ever. Since July 2015, a government-wide integrity regime applies to federal procurements and ensures the government conducts business with suppliers who respect the law and act with integrity, including affiliates of suppliers. NDP procurement critic Aaron Weir says even more needs to be done.
Well, I think government procurement has had a lot of problems. I think it's a work in progress. I think there is room for improvement, and I think good journalism like what you're doing to bring attention to these cases helps us as elected representatives to improve the system. It's certainly something that I'm willing to look at, and certainly something that I'm willing to push the government to investigate. I mean, I don't really see this as a partisan issue. I think it's about good, sound public administration, and my hope would be that the Liberals and Conservatives would be equally interested in investigating the matter and getting to the bottom of it.
He says the fact that a man up on serious charges owned a company that got a government contract is concerning. But he has this to say about the man's continued involvement after he served his time.
Well, it's certainly concerning, and definitely the priority in awarding these contracts needs to be public health and public safety. I wouldn't suggest a blanket ban on ex-convicts being involved in government contracts because, of course, we do have a correctional system that's based on the ability of rehabilitation. So, after someone has done their time, we need to be careful. But if they have, rehabilitated and reintegrated into society, that's something that we should want to encourage. So I think it's important to strike a balance here.
Coming up next week on APTN Investigates, long simmering racial tensions are boiling over in Thunder Bay after more First Nations youth drown, bringing the tragic total to 7 deaths.
I understand that Tammy and Josiah went missing the same evening. And that should alarm all of us that there is something definitely wrong in the city, and we need to find out what that is.
Families are devastated.
We are in a lot of pain and sorrow of the outcome and the result of what happened when Josiah was found.
So what are the police doing about it?
What would be a crisis? I mean, you paint the picture, and then we'll tell you whether we think that's a crisis or not. I mean, that's a hard one. What would be a crisis? I mean, one can envision all kinds of things that would be a crisis. I think acting Chief House is saying, we do not feel this is a crisis. We said, and her opening remarks were saying that to say that we are in challenging times would be an understatement, okay? So we recognize we certainly are in challenging times. That's different than being in crisis.
Cullen Crozier finds out into Serve and Protect.